Hello, I'm Dr. Aniku, a gynecologist. Welcome to Women's Health and Fertility, where we discuss important topics about women's reproductive health. Today, we are going to talk about uterine fibroids, a very common condition that affects many women, especially during their reproductive years. If you have ever been told you have fibroids, or you have been struggling with heavy periods, pelvic pains, abdominal swelling, difficulty conceiving, or frequent urination, then this video is for you. In this video, I will explain what uterine fibroids are, what causes them, the common signs and symptoms, the tests used to diagnose them, the treatment options available, and how complications are managed. Let's start by defining uterine fibroids. Uterine fibroids are non-cancerous growths that develop from the muscle of the womb, which is also called the uterus. They are also known as myomas or leiomyomas. Fibroids are very common. Some women may have only one fibroid, while others may have many. They can be very small or they can grow very large. The important thing to know is that fibroids are not cancers, and in most cases, they are benign. However, they can still cause significant discomfort and health problems depending on their size, number, and location. Most people ask, where do fibroids grow? Fibroids can grow in different parts of the uterus. Some grow within the wall of the uterus. These are the most common. Some grow inside the cavity of the uterus, where the baby would grow during pregnancy. These can affect menstrual bleeding and fertility. Others grow on the outer surface of the uterus, and these may press on nearby organs like the bladder or bowel. Some may even grow on a stalk, almost like a mushroom attached to the uterus. The location of the fibroid often affects the symptoms a woman experiences. Regarding the causes, the exact cause of fibroids is not fully understood, but we know there are several factors that contribute to their development. First are the reproductive hormones. Fibroids are influenced by female hormones, especially estrogen and progesterone. These hormones stimulate fibroid growth. This is why fibroids are more common during the reproductive years, may increase in size during pregnancy, and often shrink after menopause when hormone levels go down. Second contributor is family history. Fibroids can run in families. If your mother, sister, or close female relative had fibroids, your chance of having them may be higher. Another factor is age. Fibroids are most common in women between the ages of about 30 and 50 years, although they can occur earlier. Early onset of menstruation. Women who started their periods at a younger age have also shown to have slightly higher risk of developing fibroids. Being overweight and obese is another factor that may increase the risk because body fat can increase estrogen levels. No previous pregnancy. Women who have never been pregnant may have a higher chance of developing fibroids. Genetic and growth factors also have common association with fibroids. Changes. So, while we cannot always point to one exact cause, fibroids are linked to a combination of hormonal, genetic, and lifestyle factors. Regarding fibroid symptoms, many women with fibroids have no symptoms at all. In fact, some fibroids are found by chance during a routine scan or pelvic examination. But when symptoms do occur, they can vary depending on the size, number, and location of the fibroids. Uncommon symptoms include heavy menstrual bleeding. This is one of the most common symptoms. Some women may notice periods that are very heavy at times, associated with passing large blood clots. Periods that is prolonged, lasting more than 7 days, needing to change pads very frequently. Some women experience strong cramps or pelvic pain during menstruation. Third symptom may be lower abdominal swelling. Large fibroids can make the lower abdomen look enlarged, sometimes like a pregnancy. Pelvic pressure or discomfort. Sometimes a woman with fibroid may feel heaviness, pressure, or fullness in the lower abdomen. If the fibroid presses on the bladder, it can make a woman urinate more often. For others, where fibroid presses on the bowel, in some instances it may cause constipation or discomfort while passing stool. Another common complaint by patients is back pain or leg pain. Large fibroids can press on nerves and cause pain in the lower back or legs. In a few cases, pain during sexual intercourse is reported. Some women may experience discomfort or pain during sex. Some mothers with fibroids present with history of difficulty getting pregnant, especially those inside the uterine cavity and those located close to tubes can interfere with fertility in some women. Some fibroids also lead to recurrent miscarriages, especially if they distort the cavity of the uterus. Because of heavy bleeding, some women may develop low blood levels, also called anemia. Usually, anemic patients may feel tired all the time, weak, dizzy, some experience short of breath, and in some we notice paleness. If a woman has symptoms suggestive of fibroids, proper evaluation is very important. A thorough medical history, where the doctor will ask about history of menstrual bleeding, pelvic pain, abdominal swelling, urinary symptoms, fertility concerns, and whether there is a family history of fibroids. Complete physical examination is a prerequisite. Usually the doctor examines the abdomen and performs pelvic examination to feel whether the uterus is enlarged or irregular. Thirdly, pelvic ultrasound scan is done. This is the most common and most important test for fibroids. It helps to show whether fibroids are present, how many they are, their sizes, and where they are located. Ultrasound can be done through the abdomen or through the vagina, depending on the situation. Full blood count is also sometimes done. This test checks for anemia, especially if the woman has heavy bleeding. MRI is not always needed, but it can be very useful in special situations. It helps give a clearer picture of the number of fibroids, their exact position, and planning for surgery. This is a procedure where a small camera is passed through the cervix into the uterus. It is especially helpful if the fibroid is suspected to be inside the cavity of the uterus. Other tests are considered depending on symptoms. In some women, additional tests may be done to rule out other causes of heavy bleeding or infertility. How are uterine fibroids managed? Treatment of fibroids depends on several things, including the woman's age, the severity of symptoms, the size of fibroids and location of the fibroids. Also whether she wants future pregnancy and whether there are complications. Not every fibroid needs treatment. If the fibroids are small and not causing symptoms, treatment may not be needed immediately. The woman may simply be monitored with regular review, symptom follow-up, and sometimes repeat ultrasound scans. This is because some fibroids remain stable and do not cause major problems. Medical treatment can help control symptoms, especially bleeding and pain. However, medicines usually do not remove fibroids completely. Pain medicines can help reduce menstrual cramps and pelvic pain. Some medicines can help reduce heavy monthly bleeding. This may be given during the menstrual period or continuously, depending on the woman's needs. Some hormonal medicines can help control bleeding and sometimes shrink fibroids temporarily. Examples include medicines that lower estrogen levels or affect the menstrual cycle. These are often used before surgery to shrink the fibroids in women nearing menopause or when surgery is not immediately possible. If the woman is anemic, iron treatment is very important to restore blood levels. In severe anemia, a blood transfusion may sometimes be needed. Surgical treatment is considered when symptoms are severe, medicines are not helping, fibroids are very large, fertility is affected, or complications have developed. Myomectomy, an operation to remove fibroids while leaving the uterus in place, is a common surgery performed. This is often the preferred option for women who still want to have children. Myomectomy can be done in different ways: through open surgery, through laparoscopy, which is keyhole surgery, or through hysteroscopy if the fibroid is inside the uterine cavity. The choice depends on the size, number, and location of the fibroids. Benefits of myomectomy involves removal of fibroids, which helps to improve symptoms, preserves fertility. However, the challenges are that fibroids can grow again later, there may be bleeding during surgery, and in some cases, future delivery may require cesarean section. Another surgical procedure we usually consider is hysterectomy. A hysterectomy is removal of the uterus. This is the definitive treatment for fibroids because once the uterus is removed, fibroids cannot come back. It is usually considered for women with severe symptoms, in women who have completed childbearing, or whose fibroids are very large or recurrent. This treatment permanently ends menstruation and pregnancy, so it is only chosen after careful discussion and counseling. Other procedure-based treatments include uterine artery embolization. This is a procedure that blocks the blood supply going to the fibroids, causing them to shrink. It can help reduce bleeding and pressure symptoms. However, it may not be suitable for every woman, especially those strongly planning future pregnancy. Focused ultrasound treatment option in some centers can be considered. Fibroids can be treated using special technology that targets and destroys fibroid tissue without major surgery. This may not be widely available in all settings. Now, let us talk about the complications because this is very important. Heavy bleeding from fibroids can cause serious anemia. Management of anemia includes iron tablets or iron infusion, treatment to reduce bleeding, blood transfusion if anemia is severe, and treating the fibroid itself to prevent repeated blood loss. Fibroids can sometimes make it difficult for a woman to conceive, especially if they distort the uterine cavity or block the fallopian tubes. Management includes proper fertility assessment, identifying whether the fibroid is truly affecting conception, removal of the fibroid if necessary, especially submucosal fibroids, and further fertility support depending on the case. Not all fibroids cause infertility, so management should be individualized. Fibroids in pregnancy may be associated with miscarriage, pain from degeneration, preterm labor, abnormal position of the baby, obstructed labor, or bleeding after delivery. Management includes close antenatal follow-up, pain control, monitoring mother and baby, planning delivery carefully, and managing bleeding risks after birth. Most women with fibroids can still have successful pregnancies, but they need proper care. Sometimes a fibroid outgrows its blood supply and starts to break down. This is called degeneration. This can cause sudden severe pain, tenderness, sometimes fever, and discomfort, especially during pregnancy. Management includes pain control, rest, hydration, and observation. It usually settles with supportive treatment. Pressure effects on nearby organs. Large fibroids may press on the bladder, ureters, or bowel. This can cause frequent urination, difficulty emptying the bladder, constipation, or in rare severe cases, kidney problems. Management of pressure includes imaging to assess the pressure effect, relieving symptoms, and usually surgery or another procedure if the fibroid is large. A fibroid attached on a stalk can twist on itself. This causes sudden severe pain and can become an emergency. If there is torsion, we usually recommend urgent assessment, pain control, and often surgery. Very large fibroids causing abdominal distension. Large fibroids can affect comfort, movement, breathing, eating, and body image. Management includes proper imaging, correction of anemia, and definitive treatment, often surgery. With regards fibroids, prevention. There is no guaranteed way to prevent fibroids completely. However, maintaining a healthy lifestyle may help reduce risk or support overall reproductive health. This includes maintaining a healthy weight, performing regular exercise, eating a balanced diet, and seeking medical review early if symptoms begin. Most importantly, women should not ignore heavy bleeding, pelvic swelling, or ongoing pelvic pain. When should you see a doctor? Please seek medical attention if you have very heavy menstrual bleeding, bleeding that causes weakness or dizziness, pelvic pain or pressure, abdominal swelling, difficulty getting pregnant, repeated miscarriages, or urinary and bowel symptoms. Early diagnosis makes treatment easier and helps prevent complications. In conclusion, uterine fibroids are common and many women live with them. Some women have no symptoms, while others experience heavy bleeding, pain, pressure symptoms, infertility, or pregnancy challenges. The good news is that fibroids can be properly assessed and managed. Treatment is not the same for everyone. Some women only need monitoring, while others need medicines, and some need procedures or surgery. The best treatment depends on your symptoms, your age, your fertility plans, and the size and position of the fibroids. So please, do not suffer in silence. If you think you may have fibroids, speak to a qualified healthcare professional for proper evaluation and guidance. If you found this video helpful, please like, share, and subscribe so that more women can receive the right health information. You can also leave your questions in the comments. I am Dr. Aniku, and this is Women's Health and Fertility. Thank you for watching.